And welcome into your health. You know, as we age, there's telltale signs of the fact that we're aging. Maybe it's a little bit of grayness in your hair or a lot of gray in your hair, but a lot of things happen to your skin also. And your skin is kind of the cover of your whole skeletal system. And I have with me today Dr. Porcia Love, River Region Dermatology.
Yes.
And Dr. Love, a lot of times you're probably seeing a lot of folks getting to be my age and say, well, starting to get a couple of wrinkles here that I want to see disappear, or maybe some spots.
Right.
And
right.
even we're putting on a few pounds that we might want to see disappear.
Definitely.
So you've got some non-surgical procedures
Yes.
that are really, from a dermatology standpoint, good for you.
Definitely. Most patients, when they come in, they want something that's minimally invasive.
Yes.
That's the first thing they say. They want something that they don't have to have surgery for. And so one of our most popular treatments for facial rejuvenation is laser genesis.
Okay.
It's a laser that focuses on the dermis, that's the second layer of the skin, and it can also help with pigmentation, brown spots or red spots. This laser has lots of different ways it can treat you. It can work on fine lines and wrinkles, redness, brown spots, acne scars, and just overall facial rejuvenation, because it helps to regenerate that collagen. So it's very popular and minimal downtime, just 1 hour.
Okay, so basically you're in and out within an hour, and then
Yes.
there's no, I got to wait around 3 weeks for
Right,
recovery.
right.
It's pretty much when you're done,
Right.
you're done.
You are red for about an hour, and then you can go on with your day. It's called the red carpet laser. But you do have to do a series of treatments spaced out about 1 month apart. But it's definitely very popular.
That's great. That's great. And then, of course, basically, sometimes we're getting a few of these things.
Yes,
you say, I'd like to
yes.
see these disappear.
The eyes.
And it's primarily the eyes, isn't it?
It is. It's eyes and the neck. That is definitely a telltale sign, especially with moms who aren't sleeping.
Oh, no.
Or just as you get older. And then sometimes it runs in the family where you can get skin laxity and start to get those bags under the eyes. We have a procedure called Excelus Ultra. And it combines radio frequency with ultrasound. And so the radio frequency helps to regenerate the collagen, and the ultrasound helps to tighten. And so the most popular areas that people get treated are under the eyes and the neck to help tighten that skin up. It too is a series of treatments. You space it out 1 to 2 weeks apart, and most people do 4 treatments.
And in most cases, when you're coming in for that, you're in and out, again, probably within about an hour.
An hour, yes. Just one contraindication: if you've had stents, cardiac stents or things like that, then you cannot have it. But other than that.
Oh, is that right?
Yes.
Okay.
It works with radio frequency, and you have to be grounded.
Okay.
So that's a contraindication. But it's definitely very popular. And I always tell people you want to come in sooner rather than later, because if you wait too long, then I do think surgery is the best option. But if you can catch it early, these treatments work best for you.
And you know, you visit your general practice doctor like once a year.
Yes.
You should actually, when you get to a certain age, especially 50 plus, you should get probably at least once a year try to see a dermatologist.
Definitely,
Because things pop up on you that you say,
pop
where
up,
did that come from?
Things pop up, and people tend to not know what some of the abnormal lesions can look like. No one looks at their back. And so that's definitely where we come in. But you should see a dermatologist once a year, especially if there's a history of skin cancer in your family, so that we can give you a full body skin exam.
And those are things, again, early detection and early treatment.
Yes, that's
you can take care of it.
You can take care of it.
Minimal. I mean, just minimal.
Yes,
right.
Just a small excision if something does pop up.
And then cool sculpting.
Yes,
We've been hearing a little bit about that. And so you got one of those cool sculptors.
I do have a cool sculpting device in my office. Cool sculpting is a fat removal treatment. It's the #1 minimally invasive fat removal treatment in the world. And what cool sculpting is, it's called cryolipolysis, where the fat cells actually undergo apoptosis, which is programmed cellular death. And so we like to tell patients that you want to be at least about 10 to 20 pounds within your goal weight.
Okay.
And Cool Sculpting works on localized pockets of fat. And so the most common areas that are treated are under the neck, the upper arms, the abdomen, the flanks. Those are the most popular areas that are treated. And one treatment, you can get rid of about 25% of fat cells.
Wow.
And then 50% of fat cells.
So you say you get rid of them, but you still have to watch out what you're
You
doing.
have to watch your weight.
Because they can come back again, obviously.
They can come back if you gain weight.
This is not your green light to go out and have fun.
Right, definitely. But it is a permanent treatment if you don't gain the weight back.
Good. Well, that's a good thing to do. So your business is River Region Dermatology. You're
Yes.
located near East Chase.
Yes, we're at 2060 Berry Hill Road, which is the street that Target is on.
And you can call and have an appointment. You do not have to be referred from a doctor.
You do not. Depending on your insurance, a lot of
Okay.
the commercial insurance plans are changing where you do need a referral. So we try to catch those patients early. But if you come in without a referral and your insurance requires it, then we have to reschedule you.
Good. I'm going to get you to come back next week. We want to talk about some products that are out there.
Sure,
maybe
definitely.
Get you looking good again, right? Okay,
Yes.
Thank you very much. And
Thank
just remember
you.
this, once a year, no matter what your conditions are, and especially if you're in the sun a lot, get in and get checked. And we'll be right back right after this.